Hey, good evening, everyone. My name is Daniel Lee. I'm one of the counselors here at Garfield High School. I'm also acting as the counseling chair. Yeah, if you guys have any questions or needs, please do reach out to me. The services that the counseling office provides, I just want to really quickly go over them because I think not a lot of people know exactly what are the services that counselors provide. And I think it's critical in terms of the support systems that we have here to kind of clarify our roles and make sure that people understand where to access services. In counseling, we have three main areas where we support students. The first area is academic. And so this includes things like scheduling. So, as you know, in the beginning of the year, there's a rush to make sure schedules are correct and that students are in the appropriate classes. This also includes graduation requirements, and especially for our students to understand what are you working towards, what are the goals that you have in order to walk across the stage in June. This also includes things like administering the Running Start program. So many of you know, if you have 11th or 12th graders, the Running Start program is, we have about 200 plus students participating in the Running Start program. And that's just between 11th and 12th graders. So it's a significant portion of our community. We also make sure that students are connected to any type of services they may need related to academics. So whether it's a 504 plan, we connect them with our 504 coordinator, Ms. Beck. Tutoring, Mr. Reese, he runs the student tutor program. We also have tutors from Seattle U that tutor students here. So just making sure that we have the full academic picture and that they're set up to be successful. The second area that we work with students is making sure they're ready for college and career. So this includes things like, many of you, if you have seniors or if you have 11th graders, you know that this is really big on their minds right now. But ensuring that they understand the college application process and then really walking them through the process. Some students don't need any help. Some students have private college counselors that they work with, and we will kind of partner with them to make sure that they get the right documents, they're filling out the right forms, but especially for students who may not have that resource, we try to make sure that we host workshops for financial aid, college applications, Seattle Promise. There's a whole host of things that we do throughout the year to make sure that students are prepared. Just today I had a meeting with a student about FAFSA, and they had some questions about it, and we walked through it. They pulled it up on their laptop, and we just kind of went through the process. And then the third area is social emotional learning. So making sure that students are in a mindset where they can learn. And I think we're going to hear a lot about that today, where there's so many things happening in today's world, and with social media and technology, there's just so many distractions and things that can throw a student off course. And so, this is my favorite part of the job, where I get to sit down with the student and really just get to know them a little bit, develop a relationship, and then from there, really figure out, hey, what is the context? What's the environment that you're in? And then how does that impact your ability to be successful in the classroom or develop relationships with others? And sometimes this means working out issues with teachers. This is pretty common where students will come in and say, hey, I'm having an issue. I really don't know what to do. I'm a little bit intimidated to talk to this teacher. So anything in that world where we're working with mental health, we're working with students that have ADHD, anxiety, depression, students that are avoiding school for a host of reasons. So those are the three main areas. Obviously there's others, but I just wanted to give you an overall sense of kind of what services we provide.
Good evening. My name is Micky, Kander. I'm an advanced practice provider in the Teen Health Center, and I specialize both in pediatrics and psychiatric medicine. So I do evaluations here at the Teen Health Center. We are open Monday through Friday, 8 to 5. I'm here one day a week, although everybody's capable of doing some basic management of mental health conditions. And I'm going to stick around afterwards, so if you have questions, I'll be here.
And my name's Melanie Cope. I work at the front desk at the Teen Health Center. So in terms of like getting your kids signed up for the clinic or scheduling appointments, I can help with both those things. Main thing to point out is that the Teen Health Center is separate from the school nurse. So whereas any kid can come in and see the school nurse for like acute needs during the day and things like that, the Teen Health Center does require getting signed up, and it is good for a year. So if you are interested, we have our pamphlets in the back table at the back of the room. That has just information both about our therapists at Garfield. In addition to med management and Micky services, we also have multiple therapists on staff. And then also the forms if you want to formally enroll your kid in the clinic. Yeah, I also just want to give another plug too that we are very, very lucky to have Micky. We have medical providers 5 days a week. So in addition to Micky, we have 2 other nurse practitioners who are here who can also help with some ADHD management as well. So yeah, we're a resource and hope you use us.
I just wanted to add one thing really quick. So in addition to the counseling office, we also share the office with other support networks. So Jamie Reese, Eric Burnett, they're our academic intervention specialists. We also share an office with our school psychologist, Justin Young. So he's really a good resource for us. And then also our social worker, Jake Campbell. So there's other, networks that we collaborate with and partner with. So just kind of keep that in mind as you kind of think about the bigger picture.
I hear this a lot. Can you explain the difference between when someone can see the school psychologist versus when they might be able to do like an ADHD evaluation through their primary care or us?
Yeah, so typically Justin Young will do an evaluation when there are multiple attempts to intervene, in the classroom. So for example, if a student is having, trouble reading at grade level, or, maybe their math skills are not up to grade level, the first step is really just to try interventions, right? To get, provide them tutoring, meet with the teacher, and really kind of get a baseline for what the issue is, and then attempt, I believe there's a couple of interventions that need to be done. And then Justin Young will consult throughout that process and gather the information from teachers, any medical documentation they may have will factor into that evaluation. And so a lot of times Justin will work with the student and the family to make sure that there is a thorough evaluation, and then from there a decision is made as to whether the student is going to qualify for an IEP, so individual education plan, which is modifications in the classroom, and so that's mainly the role of Justin Young. Now, at any point you can go to your primary care physician if you have a concern. There can be underlying medical issues that impact learning in the classroom, and so it's really important to make sure that you kind of utilize those resources that you have to get the full picture.
Thanks for letting me speak with you guys today. I'm going to talk a little bit about ADHD and executive functioning. I'm casting a little bit of a broad net, kind of intentionally, hoping that it's semi-relevant to most folks here, even if you don't have a child with ADHD or suspected ADHD. What ADHD is just a cluster of symptoms related to inattention, which you see here, hyperactivity and impulsivity too. You'll notice that the way that our diagnostic manual is written is very much based on little boys mostly. And so that hyperactive side in particular in adolescents and adults, it tends to turn more toward an internal feeling of restlessness, or impulsivity is also a much broader net than what we diagnose in the DSM. You may have also noticed as you were checking out those symptoms that a lot of that is kind of normal, right? All of us have some degree of fluctuation or dysregulation in our attention throughout the day or throughout our life. All of us, to some degree, may be a little bit more active than the average person, and we all have kind of typical differences in our impulse control too. And so When you should be concerned about possible ADHD is if you think about your child's developmental trajectory and you think, this feels like a lot more though than what would be normal, especially if you've been getting feedback from teachers since preschool, late elementary school, and things are just getting worse as they get older. Of course, the symptoms have to be present for a long time, but for most folks who meet diagnostic criteria for ADHD, they're present for a lot longer than 6 months. We also want to see symptoms in more than one setting, which typically in an evaluation, we're looking at home and school. But symptoms have to be present in both settings. They don't necessarily have to be present at super impairing levels in multiple settings, especially for kids who have maybe made it to high school without a diagnosis. They may have enough ability to kind of compensate, get themselves through the day. And also, high school teachers just don't have as much time to observe kids as kindergarten teachers do, for example. The other piece here is that we're really looking for significant problems in functioning, where you feel like it's interrupting your life in some way. So some common domains that I hear when I do evaluations with adolescents is in family settings. There's a lot of arguments. They feel like their caregivers are always nagging them or getting on to them for things that they didn't do, but they definitely did it, or feeling like they're kind of always in trouble. Things aren't really fair. Socially, that impulsivity can really show up too, so they may kind of say things they regret or have a hard time maintaining friendships, even if they're really social and good at making friends. They may have a more intense emotional reaction to social drama, and more kind of typical teenage politics might affect them in a more intense way. We also know that teenagers with ADHD are both more susceptible to being bullied and more likely to be perpetrators of bullying themselves. So if you're hearing about conflict in either direction with peers. And in this developmental period too, all teenagers to some extent are faced with peer pressure. Kids with ADHD may be even more likely to be the kid that'll try anything once or be peer pressured into things. So those might be kind of social impairments you're looking out for. Academically, a kid who's not living up to their potential in some way, if they're missing out on extracurriculars because of their grades or behavior. Or I often will ask a question of like, do you have homework? Yeah? Okay, how does homework usually go in your house? And if a high schooler still has an adult sitting down with them for the duration of homework, and they're spending a lot of hours every week or every night, that's usually a cue to me that something is happening there. I also will ask folks about, how often are teachers reaching out to you? Again, in the context of how busy high school teachers are, how many students they have. If you're getting individual reaching out to you about your child, something may be going on. Or if you're, getting a lot of disciplinary action, notifications, lots of tardy skipping, things like that. Those may all be some indicators of problems in functioning. The other piece of figuring out whether it's ADHD or something else is that pretty much every mental health diagnosis and a lot of other things can cause problems with attention, feelings of restlessness, and challenges with impulse control. And so we know that life stress, transitions like the transition to high school, or looking toward the transition to college or the job market, those are all big stresses. You'll also notice I have a non-exhaustive list here of other mental health concerns that can overlap with ADHD. They can all also co-occur with ADHD, so it's tricky. If you've got questions, and if you're thinking, I don't know if it's ADHD or not, this is why we do evaluations, because it's a big process, and so we have to rule a lot of things out. But the maybe good news is that a lot of the treatments that work for ADHD, especially the behavioral treatments, which is what I specialize in, they work for everybody to some extent, and we just have to be a lot more serious about them for kids with ADHD. So I'm going to talk a little bit about some general themes there, but if this is looking familiar or worrisome to you in some way, maybe time for an evaluation. I also want to try to define executive functioning for you. It's something that's just like ADHD, kind of more popular and in the zeitgeist now. But what we really mean when we talk about executive functioning, it's a very broad term, but it describes these higher order cognitive or brain functions that allow us to maintain goal-directed behavior. So it allows us to work toward things that are important to us. These are the big three that I research. So working memory, the way I describe that, it's the ability to take something into your mind and then do something with that information. To hold it in your mind while you do something else, to change the order around or to be flexible with it. Inhibitory control is the ability to stop yourself from doing something that feels automatic or to stop yourself from doing something that you've already started. And then cognitive flexibility or set shifting is the ability to switch between tasks. So the ability to go from working on math homework to history homework, the ability to answer an email and then have a conversation over here and then go back to your email. Executive functioning deficits are incredibly common in ADHD. Some people, myself included, believe that they are kind of the core of ADHD. And even in folks with really rigorously diagnosed ADHD, the strengths and weaknesses in different executive functions are different for different people. So we are still not at a point where we can look at like a profile of executive functioning and say, yep, that's a person with ADHD, that's not a person with ADHD. And so some people with ADHD have significant deficits in all executive functions. Some people have a mix. There are also some people who have like really great set shifting, but really bad working memory, for example. And along those same lines, these are higher order cognitive functions that are right here in your prefrontal cortex, which is not developed fully for anybody until sometime in our mid-20s. And so these are skills that all kids are still developing at this age, and they can also be present outside of ADHD. So when we think about anxiety, depression, all of those other common mental health concerns, it affects executive functioning as well. This is just a little bit of an overview of some of the kind of brain systems that are impacted in ADHD. So like I just talked about, that frontal lobe, your prefrontal cortex, that's like the boss of your brain, right? It's where all of those executive functions usually kind of sit, so to speak. And again, for all kids, this is not a fully developed or mature part of the brain yet. For kids with ADHD, there's like a 30% developmental lag. So to make the math easier, I usually like subtract 3 years, although it doesn't actually work that way when they're teenagers. There's a couple of other systems. So the basal ganglia, those structures are the reward centers of the brain, and we know that reward operates differently for people with ADHD. And so part of the role of this reward center of our brain is it tells us what to focus on, right? Keep focusing on that thing that's rewarding, that feels good, that gives you that dopamine hit. That part of their brain is fully developed in adolescence. The last part of the brain that can be impacted in ADHD is the limbic system, or like your lizard brain, if you get the gist of that. It's the emotional center of your brain, right? It's where we have those very core emotions of fear, of fight or flight or things like that. This is also fully developed at this point. So the way that I always describe this is we have a gas pedal of a Ferrari at this point in our brain. That emotional center, that reward center, it is online, it's ready to go. And the brakes are like rusty bicycle brakes, right? So they're not gonna stop those impulses as quickly. And so I say all of this not to try to like get you to learn about neural structures or anything like that. The idea here is that if your child is having trouble with this, it's not their fault, it's not your fault either. And there are things that we can do to support. There are ways that we can kind of try to understand where they're at developmentally and come alongside and support them. I'm going to shift a little bit here to talking a little bit more about some of the general themes that I tend to target in some of the treatments that we do for teenagers with ADHD. So I won't read all of this to you, but the general gist is that if you have a teenager that struggles with attention, executive functioning, academics, if they have ADHD, what we often see is that caregivers end up kind of falling into one of two patterns. On one hand, you may be so overwhelmed and stressed, and you might kind of give up and let go a little bit and not know a lot about what's happening academically, or you don't realize how bad things are until you start getting the calls or the report card comes in. On the other hand, and probably the more common thing that I see, is that we understandably don't want our kids to fail. We don't want them to experience that struggle. And so sometimes folks will kind of go toward the other end and become like a little personal assistant. You may feel like you have fully taken over all of their organization, their communication with teachers. You're the one that's like checking to make sure they've turned everything in, or you're sitting with them while they're doing homework and things like that. So if these patterns look familiar to you, maybe time for some help or support. What we want here is for folks to fall somewhere in the middle, right? We want to promote kids' autonomy and learning and gaining these skills while still having the guardrails up so that they're not totally off the deep end, right? I think about it like bowling. We want the bumpers. Occasionally they're gonna knock up against one of the bumpers, and we wanna be there to kind of get them back on course. But otherwise, they're throwing the ball themselves at this age. That's the goal. So these are some general themes of what I try to kind of get people to, or where we end up, hopefully, throughout the course of treatment. The first is that when we talk about motivation and executive functioning for all teenagers, especially teenagers with ADHD, one of the things that we try to get caregivers to do is start to elicit from their child instead of imparting to them. So the way that we think about this is the typical kind of strategy of parents is that we have all this wisdom, we have all this knowledge, we want to help them so bad. And so we tell them why it's so important that they get their homework done, or that they turn things in on time, or that they wake up for school at a reasonable hour, or go to bed at a reasonable time. And we try to impart all of this wisdom onto them. And usually, understandably, they're not ready for that yet. They want to gain their own wisdom, right? So some ways that we talk about how we elicit from them their motivation, I will sometimes have people literally write down, what do you hope your life is going to look like when you're out of high school? That could be, what kind of job do you want to have? What kind of friendships do you want to have? What kind of money do you want to be making? What fun activities do you want to do? Have them envision their life. If they can't think after high school, bring the deadline closer. How do you want your life to look at the end of this semester? Do you want your life to look like you're cramming for a couple of weeks, or do you want to feel like you're coasting at the end of the semester? And then caregiver does the same thing. And what we often find here, for the most part, is that people are surprised, and there is usually a lot more overlap than we think there will be. And so we want you to compare those big picture goals and look for any little area of overlap or agreement. And then we trace it back, right? Okay, if you want to get into this college in 2 years, what do you think you need to be doing right now? And what's the first baby step? Very smallest first step that we can take to get there. And how can we be as specific as possible in that? Another way that we can elicit instead of impart is that we can lead this process by example a little bit and kind of model. And so if you have a teenager who is not into the whole discussing the future and finding their motivation sentiment, that's okay. You can do this yourself too. You can let them know, like, well, this is what I'm hoping our relationship looks like in 2 years when you're done with high school at the end of the semester. And so I know there's some things I need to work on and I need to change for us to get there. This is what I'm thinking might be a good first step. So that's what I'm going to commit to. No worries if you don't want to commit to anything right now. That's kind of the vibe. Yeah.
Sorry, can you do like 3 steps that way?
That way? Okay. Yeah. And then the last piece here is if you get this far in the process, you can help kids identify even those small points of motivation. So if there are some things that you kind of agree on, but it's not super high on their priority list, but it's not a 0. Okay, why is it a 1 and not a 0, like on a 1 to 10 scale? And what would make it even 1 point higher? Those are some common motivational questions that we might ask. The other piece here is that there are going to be times where they are, unfortunately, still a child, and so their choice is low in some situations. There are things that are necessary that they don't really get a choice of whether or not they do them, and they're not really motivated. And so in those cases, providing the rationale that we can is really crucial. And also thinking about ways where we can add motivation even if it doesn't naturally exist. This is kind of a slide that we show in one of our treatments. And the idea here is that if you tell a high schooler that they should use a paper planner, you're not going to get very far. And we still do it every time. And part of that is that we know it works, unfortunately. And most kids are not motivated to do it. And they don't understand, right? Like, it's stupid. Why would I add work to my work? And so we present them with this rationale, or we present their caregivers with this rationale. But then we also have these points where we can, like, be flexible. It doesn't have to be a paper planner. We want, like, the vibe or the spirit of a planner. So we want something where everything is all in one place that gets updated in real time. Doesn't have to be a planner. We want something where you're, like, actually doing something with the information so that it is more likely to get encoded in your memory. So when we can't give kids a lot of choice, it's helpful to at least give them a valid reason why we're asking them to do something. The next kind of general theme here is that you want to overplan and then overplan some more and then plan for those safety nets to fall through as well. That's especially if your child has ADHD. Hopefully most folks have heard of SMART goals, or it looks kind of similar to you in some way. But the idea here is that when we talk about those baby step goals, we want them to be specific, very concrete. We want to know how we're going to measure it. How are we going to know if this goal is met? We want it to be realistic and attainable. We want to actually gain momentum here rather than beating ourselves up over it. We also want it to be relevant. So we want to find that point of, like, why the goal really matters. And time bound. We need to know when we're going to check in about it. And then you'll notice here that I said, consider and plan for every single part of that process. So I have an example SMART goal here of, like, I'll write my assignments in my planner, or I'll update my Google Calendar at the end of 3rd period and 6th period every day. And if that's my goal, I'm gonna need to plan for every possible distraction or problem that might come up in that process. The other piece that you want to be considering is where your student might get hung up. Which part of this is going to be the hardest for them to do? Which part is going to be boring and not rewarding at all? And can you find something, a carrot, if you will, at the end of that stick to help motivate them? So this is an example of planning and then planning and then planning and planning. Again, this is something that we show to folks in the treatment, but you can see how wildly specific we make them be, right? Do you actually have the thing you would need? What's gonna happen if you don't write it down? What are you gonna write down if there's not anything to write down? What are you gonna do if you forget the thing that you're supposed to write the thing down in? Who's gonna check? When are they gonna check? What's gonna be your goal? Lots of questions here. Again, the reason I show you this is not that I need you to go home and try to have your kid use a planner, but it's an example of how exhaustively you might need to kind of overplan. The other piece that we often talk about is prioritizing connection before correction. So I always ask caregivers to think about the kind of supervisor or boss that you want to work for, who makes you feel like you're good at your job, you know what you're doing, you can do it, and you want to do it. You may not have a boss, but you could create a fictional one in your mind that makes you feel this way. And the idea here is that a lot of those things that motivate us as adults also motivate teenagers. And so some of the ways that we can prioritize that connection piece, which is important to being a good caregiver, a good supervisor. We want to validate the emotion before we try to correct the behavior. So you can see some examples here where it's literally just labeling the emotion, guessing at the reason why, and sometimes letting it sit, right? So not saying, I know you're stressed about that project, it's overwhelming to even get started, but you should have started it 2 weeks ago and that's why you're so overwhelmed and right? We want to stop just at the validation before we try to motivate, correct. And then the other thing that you can do is really, really try to look for any and all tiny things that you can praise or give positive attention to before you rely on those negative consequences. So instead of if you don't get your homework started right now, your phone's going away for the rest of the night. We may find a day where they get started right on time and say, hey, thank you so much for getting started right on time. Even though that's an expectation, even though it may be hard for us to catch those things, we want to find those things that we can give positive attention to and prioritize that over the negative attention. I also had some folks ask about prepping for life after high school. I think some of these things are important for all kids. For context, I also used to do ADHD evaluations with college students, and so some of this is related to my experience there. The thing that you want to remember is that these executive functions, regardless of if your child has ADHD or not, they're skills, and they're things that require sometimes very explicit instruction. This is how you do this thing. This is how you break it down. And a lot of practice. If you have a child with ADHD, they need exponentially more practice and repetition than their typically developing counterparts. And so give them those opportunities to practice. We don't take away all the guardrails at once, right? Autonomy is a thing that builds over time. And especially if you find yourself falling into that personal assistant trap, one thing I often encourage folks to do, especially when they come to me and they've got a junior or a senior and they're like, oh, but Nicole, how do I get them to actually do their homework or show up to school on time? I might, instead of giving them a perfect tip or trick, ask what you can let go of or what they might be able to fail a little bit while they still have the ability to have adult support and while the consequences are hopefully a little bit less permanent. This is a non-exhaustive list of some important skills that I think kids should start practicing in high school. Making phone calls or like making appointments online, learning how to keep track of those things, creating a plan for your day or your week that doesn't just include school stuff. So like, when do you do your laundry to make sure that you have clean clothes? When do you stop by the grocery store so that you're not starving? Also really important, if you do have a child with ADHD, anxiety, depression, if they take medication, if they have an IEP or a 504 plan, they gotta know that. So we want them to know the basics of their health history, their academic history. There may also be a point at which they start kind of storing their own records after high school and talking with them about like where we put the important papers and how we make sure we don't lose them. And then identifying ways to get help. So especially for those of you with older high schoolers, if you are at this point of like, ooh, I really think they need help, I'm gonna get started on that. This may be something that they could do with you to see how you navigate that system, because it's tough to get help academically in the healthcare system, and it's definitely something that requires practice. The other thing that they should really start practicing is how they communicate with their teachers, their bosses, their peers. So thinking about the places where you can support them with communication without taking it over, places where they might be able to initiate that email or that conversation, and talking with them really explicitly about like, what do you actually want to say? What are you hoping the other person says? Okay, I don't think you're actually saying that in that email, right? So helping them kind of learn those skills. Last piece here is places to get help. So I always encourage people to start closest to home or school, and so you guys have some great resources here. Primary care is an excellent first stop if you've got a PCP. We also have the Washington Mental Health Referral Service. You do not have to be a Seattle Children's patient to access this. They have an online interest form and a phone number. You can give them your insurance info and what you're looking for, and they can help you connect to people who have openings. And then for those of you who are thinking a little bit into the future, one of the places where you might connect if your child currently has an IEP and they're gonna need accommodations in college, most universities have something called either a student disability office or accessibility office, and that would be the place where you're usually gonna stop first for those sorts of things. These other bullet points are self-guided things, internet things that I think are helpful. I'll highlight CHAD as the primary place where I always direct people. It's got a lot of great information about ADHD across the lifespan and some very practical tools as well. There are also CHAD support groups in the King County area. So, all right, that's it for me.
I think we have time for a couple of questions. So the one submitted online was, and I'm paraphrasing here, but if my child is self-conscious or feels there's stigma around ADHD, and so they're resistant to seeking help or accepting the help that has been offered, how do you go about encouraging that student to get the help that they need?
Yeah. Great question. I think that's one of the places where that eliciting piece can really come in. So they may be really self-conscious to use certain accommodations or services, and those services or accommodations might be the things that are going to get them a step or two closer to their goals. And so if we can spin it that way of like, listen, I know it's like maybe a little bit embarrassing to go to a different place, take a test, and I hear you saying you want to make sure you get all B's this quarter, and I'm looking at like the grade book from last quarter, and the tests are really the thing that does you in. And you work so hard and you study so hard, and I feel like you can't show what you know on the test. The other piece that you could do here is, especially if it's like an anxiety, self-conscious thing, you don't have to use all the accommodations all at once. You don't have to use the most embarrassing ones. You can like do a little gradual exposure to using accommodations and test it out, see how it goes. If you use the accommodations and it doesn't actually help you, all right, cool, no need. But maybe you use one of the more kind of private or not embarrassing accommodations, and you find that it actually does help you, and then you feel a little bit braver about using some of those other ones.
I just have more of a comment than a question. Thank you for all that. Just to say, like, I think it's really important also to emphasize how therapy can be so helpful for these kids, that like the anxiety, the depression, you know, maybe it's not, who knows what it is, but anyway, so anyone whose kid is struggling, like, reach out. There's great resources here, and it can make a difference.
So a question about apps or books for students to use. Or websites, yeah. Chad, I think, is very accessible for all ages. And the reason why I plug it so heavily is that ADHD is very popular online. And not all of the stuff on like TikTok, etc., is helpful or accurate. And so I like Chad. I think, you know, if we're talking like organizational skills, finding the app that works best for them, that they're willing to use, whether it's like a calendar app or there's plenty of planner apps. I'm kind of boring and I just use Outlook for everything, which I don't find that most high schoolers are into. There are also some apps where you can kind of like gamify your boring tasks in a way. Finch is an app where it's kind of like Tamagotchi for those of you who had those, where you can put tasks like getting your homework done, getting your laundry done, whatever, and you can earn little fun things for a cute little bird, so you can like dress them up and feed them and do fun things like that, and gamify your life. So I like that app, and some of the teens I work with also do.
I get a lot of students that have both symptoms of ADHD as well as anxiety, and they can look like each other. So for example, what Nicole mentioned earlier was that when we do an ADHD evaluation, we have to rule out a lot of other stuff, but anxiety being the top one, and academic anxiety in particular. And if you look at the symptoms of generalized anxiety disorder, one of those things is attention and concentration deficit, like you have a hard time focusing. And so it's our responsibility to ensure like that, well, what is robbing you of the attention and focus? Is it that you're daydreaming and distracted? Or is it that you only have enough mental real estate up here and you're worried about the exam you have to take, or who you're gonna go to prom with, or like all of the other stuff that I don't, at my age of 50, I don't care about anymore, but like it's so important to these kids about what they see on TikTok. So it's mostly that. I think other times I do have circumstances where parents have really strong feelings about what their kids' mental health circumstances are, and so we'll have to navigate that. Meaning that like parents have already diagnosed your kids because you know them so well, and so then we have to have that conversation. And the last thing I think also is that I don't know if you're aware, in the state of Washington, you can consent to your own mental health care at the age of 13 and older. Anybody worth their weight, any provider worth their weight is going to try desperately to work with you. I've only had one circumstance where a child did not give me permission to talk to their parent. And so just so you know that we try to do that, although ultimately it is anybody 13 and older, their right to be able to consent to their own mental health care. And just to be clear, like we're under different guidance in the Teen Health Center because we're under HIPAA, the Health Insurance Portability and Accountability Act. versus FERPA. So if a child tells, FERPA is for the school, I don't even know what it stands for, but Federal Education Relaxation Parenting Act. I don't even, whatever it is. But meaning that like if the child tells a school counselor, they have to tell you. If they tell us, we don't. So there's a little bit of a schism between that. Anyway, so that's usually kind of the sort of tension that we experience in the health center. We really try to navigate it so that we don't have parents feeling like they're kept in the dark.
Thank you so much.
Yeah.
Great, thank you so much. And yeah. Dr. Groves just very kindly said we can put her presentation up on our website. So if you know someone who missed it or you want to refer back to it, it will be there. Do you have a quick question in the back?
Typically, much shorter waits compared to like external providers. So for instance, like if a kid walked in today for therapy, I could offer them probably Friday or next week, like very, very quick. For Micky, his first available is, I believe, 3 weeks from now, which still, like, that's not bad compared to a lot of other places. So typically we do have a fair amount of flexibility with scheduling and are available sooner.